Hi, I'm Cyrus, a student nurse from Cedar Crest College. Today I'll be talking about how music therapy has a positive influence on women with breast cancer following a radical mastectomy. First, um, why did the researcher choose this topic? There must have been some type of problem. The problem is the fact that women that have breast cancer and get their breast tissue removed will have some type of body image disturbance or decrease in self-esteem. Um, Especially if you're like a younger woman that goes out in public a lot and or wear a bathing suit. I mean, that's really going to affect your self-esteem. And through this, there's going to be a research question here. What is the research question? It is how music therapy affects the anxiety level of a patient that has breast cancer following a mastectomy. So let's see what the study significance of music therapy is. From pharmacology, we learned the fact that we should always do non-pharmacologic methods first. So try to do an intervention that doesn't promote drugs is always a good factor to start off with. If that doesn't help, then we can go to anti-anxiety medications. Alright, so the research critique is the framework was the Hall's Course Care and Cure model. Here, the core problem is what affects the patient itself. It's the disease, it's the breast cancer. And then in a broader range, how is the patient suffering from this? Whether they're suffering from the disease and an increase in anxiety. As a nursing student, we had to come up with interventions to how are we going to fix this? Well, in this scenario, we use music therapy to decrease anxiety levels. And if this works and the patient reports a decrease in anxiety, then we know our caring plan worked and our outcomes were met. If not, we would have to do a different intervention. So I would like to talk about the independent and the dependent variables here. The study used the independent variable is music therapy, and there was roughly around 200 different types of music, and they were categorized into 3 different groups, majority of all Chinese related, because it was conducted in China. The dependent factor here was the response of the experimental group from the music therapy. Also, the study mentioned the fact that some members that weren't adherent to music therapy during hospital stay, they received telephone calls post-operatively to make sure that they were adhering to the music therapy outside the hospital setting. So their response to the telephone call was a dependent factor. So the sample, there's inclusive and exclusive criteria. First, what was inclusive was you had to be a woman with breast cancer, you had to have a mastectomy done, and of course, you need to have music. The exclusive criteria were all the opposite. Of course, if you didn't like music, or if you were allergic to music, or had auditory disturbance, then that wouldn't have helped, and you were excluded from the experimental group. Also, all these other factors. So, one thing to take into account as nursing majors is the fact that treatment shouldn't be done passively. I mean, the patient has to be, that has to be an appropriate time. They have to accept treatment to actually affect and reduce anxiety. Alright, so how did they collect all this data? First, before the eligibility, they had to get a written informed consent. Then here, through a range from March to November 2009, the data was actually collected. And they used two major types, the standard demographic questionnaire and a Chinese version of the state anxiety inventory. And then they obtained 120 samples, and through computer programming, randomly divided these participants into 2 groups, control and experimental. And the reason they chose 120 was through a secondary source, which used 100 members, and then those members, they obtained the fact that through 100 members, they got 80% power of analysis and a 5% level of statistical significance. So this research took it one step further, added 120 for a 20% drop rate. I went one step myself, and I added the fact that the attrition rate and the retention rate into my data. And you can see that it has low attrition rate and a high retention rate, which tells us that it was a good study, and in fact that this data that was collected has significant relevance to the general population. One limiting factor I would like to point out is the fact that there was 6 participants and 9 participants that dropped, and the author didn't mention why they were dropped halfway through the study. Here, I would like you guys to focus on. This is the chart of the demographic analysis. They're all nominal data besides age, which is interval and ratio. But as you can see, the probability is all greater than 5%. And that tells us what? It tells us that there's no significant difference between the experimental and the control group, and that's exactly what we want. We want to be comparing apples to apples. Here in this chart, it tells us the decrease of anxiety due to music therapy. And I want you to focus on the probability and on these values over here. And you can see it's significantly less than 5%, which tells us that there is a significant difference between the experimental and the control group. And from first post-test to the second post-test, it's almost double. So that tells us that the patients reported half the amount of anxiety from 1 week to the next week. And then from post-week 2 to post-test 3, it went down only around 1 unit. So that tells us it started plateauing out. And it was still a significant difference, but not as much as the week, from week 1 to week 3. So some limitations I already went through, but I would like to point out the top one. It's self-reported data, which is highly subjective, and it could alter the results. That also, I'd like to point out that the study was conducted, the music therapy was conducted in 4 weeks, but the data collection was through March through November, and the author doesn't mention what happened all those other months. Another important factor to take into account is that the study was conducted in one facility in China, and I would like to know how other cultures and other regions would, how music therapy would affect their anxiety levels. So some nursing implications, which I already went through, is to definitely know from prior research that the chief complaint of most patients with breast cancer following a mastectomy is anxiety. So as a healthcare provider, if we can know that the chief complaint is anxiety, by targeting the chief complaint, we can have a significant impact on wellness, to increase wellness efficiently. Also, the fact that we're using a non-pharmacologic intervention instead of using antipsychotic drugs. So what I want you guys to get from this is the fact that through prior research studies, that music does in fact decrease anxiety levels in women that have breast cancer following a mastectomy. Also, one nursing intervention factor is the fact that after around 3 to 4 weeks, music therapy starts plateauing on anxiety levels. So a nurse should take into account to maybe use an alternative intervention at that time, around 3 to 4 weeks, or maybe add a second intervention to help reduce anxiety levels. Thank you for watching, and that's all.